Hey, what's going on, everybody? My name is John Couri, LCDC III and student nurse, coming at you with another video. This video is all around why we're seeing these increase in depression rates and suicide rates in children. This is a huge growing topic in the area of mental health. We do not know why exactly. We've got some theories, but we do not know the exact mechanism of why this continues to grow. Year after year, we see higher and higher suicide rates in children, especially the 10 to 14 age range. This is a very problematic area. Some of the hospitals we work with, some of the places I'm doing clinicals at, we've seen that there's so many suicidal, depressed children that cannot just be released. There's nowhere to send them. So these facilities that we have to even take care of these problems, there's not enough resources to take care of it. So we're going to dive into it this video, why this is occurring and some possible ways to prevent and treat this problem. So firstly, we're going to take a look at the smartphone. There's a term called nomophobia, that is fear of being without an electronic device. This is really taking over little kids' lives. I don't know if you guys have seen it, but when you go outside now, everybody's buried in their cell phone. Nobody's talking. Everybody's always looking at that phone in their own little world instead of just being present, being in the moment, enjoying the people, the things around them. And with this, you would think that being able to escape into your own little universe would be healthy. But what we're finding is you're constantly going from one thing to the next, and what it causes is what's called sensory overload. What that happens is the developing brain can't handle all this information constantly coming in. What happens is the brain almost shuts down, reverting to that depressed state, increasing that risk factor for suicide, depression, and all of the other mental diseases that can follow with this. So very interesting study came out that showed that 66% of Americans suffer from this problem. I mean, that is unbelievable. 2/3 of our population can't go without their cell phones. I can't even say I'm immune to this. I find myself automatically checking my phone at times because that is the time we are living in, right? So teenagers, another study that came out showed that teenagers who spend 5 hours or more on their cell phones are 71% more likely to have suicide risk factors. It's a very significant thing. That goes to show you 5 hours accumulatively, that adds up very quickly. So whether it's 10, 20, 30 minutes here, there, and as with every cell phone, you can very quickly get caught in that rabbit hole of going from one topic to the next, the next, the next. And this adds to that 5 hours very quickly. And especially with that developing brain, when that's seeing this information constantly, it can't make sense of it all. So we have a lot of clients here. They struggle with their kids having depressed thoughts, even suicidal risk factors. And what we're trying to find and educate them on is they need a break from the phone. So another big area that the smartphone and these electronic devices can cause is they emit something called blue light. Now, when we see light, we see it in different frequencies. Blue light, for some reason, causes the most stimulative activity in our brain. So what that means is when we're outside, when the sun is out, we get a lot of blue light wave frequency. And that tells us, hey, be awake, be alive. This is the time to be active. Now, when that goes away, blue light almost turns off, and that signals to our brains, hey, it's time to go to bed. What these phones do is they send that blue light into our eyes, into our brains. When that happens, that tells you, hey, the sun's out, stay awake. Our brain has no idea to differentiate that blue light from the blue light from the sun. And what that causes is us to stay awake. These poor effects on sleep, as you guys know, I'm a big advocate for sleep. Sleep is so important. It's one of the most important things we can do throughout our day, throughout our lives. And as we get less and less efficient sleep, we pretty much go crazy. Our brain dries out. We don't get the restorative properties of it. It makes us irritable. It makes us angry, mad. I'm sure we can all relate. Those days that we don't get enough sleep, we're just a wreck the next day. I know I personally am very much a wreck. So we're going to take a look more at this. This graph right here shows you in 2008, there's this huge spike upward in suicide rate, and suicide specifically from ages 10 to 14. Now, very interesting to remember that the boom of the iPhone, the boom of all these electronic devices came in 2008, and they've tied a lot of studies to that. Now, another chart showing, once again, 2000 to 2016, that boom at 2008. They've done a lot of these studies, and this affects everyone from age 15 to 75 even. They've seen huge uphill climbs from these suicide rates. Nobody knows really fully the exact parameters of why this is happening, but we do know that smartphones, electronic devices really took off in this time. And it's very funny that we created this different universe from the one we live on through this electronic escape, and with that came all these problems, specifically suicide and depression. So things that we must take care of, these are very big ideas. You know, weather changes, the very systematic way that we process this information, we have to reboot it. We have to get back to that natural way of living without these smartphones. Now, smartphones are great. We got to just use them appropriately and not let them consume our lives, because that will drive up suicide rates, okay? So first thing that I want to talk about is enjoying that natural sunlight. When we can, when the sun is out, we need to be getting outside. Take your children, take yourselves, get outside, enjoy that. That soaks up vitamin D in us, and that's very correlated to mental well-being, as vitamin D levels and sunlight exposure. Next is green tea. Green tea is a great way to not only buff your immune system out, but also it just releases natural compounds in our body. The warmth and the natural elements of green tea is very promoting to not only metabolism rates, but your immune system. These are two things that are automatically suppressed when you are in a state of depression or risk factors for suicide. So naturally doing that will combat the negative effects of overuse of smartphones, which can cause these suicide and depressive risk factors. Next is daily meditation. I'm very big on this. I'm going to go into more depth on this on different videos, but for this video, just the premise of it is being here, being present, being in the moment. If you can take a mantra and repeat it several times, it's been very powerful and it's been proven. This is very healthy for us to do. Something that I do sometimes is I repeat, I love myself. And I just try and focus on my body's natural processes, trying to drown out all the noise of the world, trying to shove its information down my throat. I just repeat this mantra, and I will do it for 10, 15 minutes right before bed. It helps me sleep like a baby, and there's endless studies on it that it increases brain activity and brain consolidation. Next thing is using light boxes, synthetic light, whether it's, you know, a Himalayan salt lamp I'm big on because it's so cool looking, but anything you can do to light your room up. The lighter the room during light hours and throughout the day, it's very, very important to tell yourself, hey, it's time to stay awake. This is important, because it tells us when it's darker for whatever reason, our brain kind of figures, hey, it's time to go to bed. And that tiredness feeling is once again something we find in people who are depressed and struggling with suicide risk factors. And last thing is taking a vitamin D supplement. A lot of doctors say that a lot of the United States population, especially states where winter is prominent, we have vitamin D deficiencies. So it's very important to take a vitamin D supplement, as this aids us in many ways to keep us protected against depression and suicide risk factors. And the last slide I've got for you guys is all around the endorphin system. Now, this is an absolutely incredible system. You know, the way this works is when we exercise, when we go through pain, we release these powerful long chains of proteins, pretty much, that allow us to numb that pain. And that pain, it's almost a pleasure to take pain away. So exercise is the most natural way to do this. And this study right here from Dr. Chuck Hillman at the University of Illinois demonstrates the brain, when you are just sitting there quietly, your brain almost turns off. It goes into a very null state. You're only using part of your brain, and it's very in a dull state, if you will. Now, after 20 minutes of walking, we get this huge boom of endorphins. With that comes all of the brain activity. So as you can see in the red, the green, the yellow, this is increased brain activity. That red is highly, highly attuned brain activity telling you, hey, we need to be thinking, we need to be recovering, we need to do all these things. Now, part of this is from the fact that exercise boosts metabolism. Exercise makes you feel better. If you ever leave the gym, you never leave the gym feeling worse. You leave the gym feeling better because our brain is active. All of those different sites of the brain are talking to one another, communicating, coming to life. And through that, it prevents depression, and it can very much not only prevent, but avoid any kind of risk factor that we might be having. So this is just some of the stuff that I wanted to bring. I wanted to end this with some powerful questions that you could ponder, as well as, you know, have children ponder. So I feel happy, content, or fulfilled when So asking yourself that question, what are the things that light your soul on fire, that tell you, hey, this is why I'm living, this is why I'm alive, this is what makes me feel alive. It's so important to remind ourselves of that, guys. Too often we have these great ideals, these things in our lives that we want, we need, we yearn for more, but we just kind of put them to the side. And, you know, a problem with the smartphone is it gives us instant access to not only distraction from the things that we want, but distraction from the journey that will allow us to get to that place that we want to be. So very important. Next question, next year I will have accomplished blank. It could be anything. I don't care what your goals are. You need to be making year-long goals and then finding ways to re-engineer that goal into a series of mini goals that adds up to that large goal. When we do this, we feel accomplished, we feel purpose, and we feel like our mission is being fulfilled in life. And the last is, am I happy with the man or woman I am becoming? This is a big question to ask. This is something that really you got to do some soul searching. But are you happy? Are the decisions you're making day in, day out, when you lay down at night, are you happy with those decisions? The behaviors, the patterns that you're forming and systematically going throughout your day, are you okay with them? Do you go to bed almost smiling, thinking, man, I killed my day and tomorrow I'm going to feel the rewards of what I did today? So always keeping these questions at foremost and forefront. Like I said, we're going to be doing more videos diving into each topic. But thank you so much for tuning in. If you guys have comments, questions, concerns, please let me know. If you guys work in this field, I want to know what you guys are doing, what therapies you're prescribing, what things you are seeing, so that we can all come together and tackle this problem together. Thank you, and until next time.